One fall can steal your independence in seconds. That's the fear many women over 60 carry quietly every day. And now, doctors warn 99% of older women lose balance from 6 common mistakes. The good news? Every single one can be avoided. Stay with me because I'll reveal the science behind these mistakes, plus the simple daily habits that keep you steady, confident, and strong. After 60, many women notice little slips, wobbly steps, slower reactions, near falls that shake confidence. It's easy to think, this is just aging. But here's the hopeful truth. Most balance loss isn't inevitable, it's preventable. In this video, we'll uncover 6 common mistakes that quietly erode stability. You'll see what's happening inside your body, and how small corrections like nutrition, exercise, and safer routines can restore strength and peace of mind. Because protecting your balance isn't just about avoiding falls, it's about protecting the freedom to walk, play, and live independently for years to come. Come one. Mistake number 1. Ignoring vestibular decline. Let's start with the very center of balance, your inner ear. Inside there are tiny hair cells and calcium crystals called otoconia. Think of them like the gyroscope in an airplane. When everything is in place, your body knows which way is up. But after 60, those sensors begin to fade. Research published in the Archives of Internal Medicine, 2009, found that women lose these otolith crystals faster than men. And as they shrink or shift shape, your brain gets fuzzy signals about movement. The result? Wobblier steps, slower reactions, and more stumbles, often long before a major fall. Ellen, one of my patients at 71, told me she dreaded stepping off curbs. She wasn't weak, but she always felt a strange pull to the side, as if her body didn't trust the ground. The good news? You can retrain this system. In my clinic, we use simple gaze stabilization drills. Twice a week, Ellen would sit in a chair, hold her thumb at arm's length, and gently move her head side to side while keeping her eyes locked on that thumb. 30 seconds at a time, 3 rounds. It seems simple, but after a month she noticed something powerful. Walking across her kitchen no longer felt like tightrope walking. The gyroscope inside her had steadied again. Here's the key. Your vestibular system is like any muscle. Ignore it, and it weakens. Train it, and it sharpens. But that's not even the surprising part, because the next mistake is about a vitamin deficiency most women never connect to balance. 2. Mistake number 2, skipping vitamin D. Here's where it gets interesting, because balance isn't only about your ears or muscles, it's also about one overlooked nutrient, vitamin D. Vitamin D is like the light switch that turns muscle fibers on. Without it, your legs can feel heavy, reaction times slow, and postural muscles weaker than they should be. A 2024 study led by Tan and colleagues showed that older adults who took 800 to 1,000 international units of vitamin D 3 daily reduced their fall risk by 15%. That's not just a number. 15% fewer dangerous falls means thousands more seniors keeping their independence. Margaret, 68, used to dread stairs. She told me, every step felt like my knees were sinking into sand. Her doctor checked her blood work. Her vitamin D was low. With approval, she started a daily supplement. 1,000 IU vitamin D3 taken with lunch, always paired with healthy fat like olive oil for absorption. 3 months later, Margaret noticed something subtle but life-changing. She could climb her church steps without gripping the rail. The fear in her eyes gave way to confidence. So, what can you do? Ask your doctor for a blood test. Look for serum. 25O HD levels between 30 to 50 nanograms per milliliter. If low, discuss a supplement of 800 to 1,000 international units. Vitamin D3 daily. Take it with meals that contain fat. Think salmon, avocado, or even a drizzle of olive oil. Remember, more isn't better. Studies show doses over 2,000 IU don't add protection and may even backfire. The sweet spot is modest and consistent. Pause for a second. Do your legs feel heavier when walking uphill? It might not be just age. It could be vitamin D quietly running low. And the next mistake, it has nothing to do with nutrients at all. It's about a kind of training most women skip entirely. 3. Mistake number 3. Lack of targeted balance training. Now, let's shift from nutrients to movement itself. Even if your muscles feel strong, they can lose their sense of position, what doctors call proprioception. Inside your muscles are tiny sensors, called spindles, that tell your brain exactly where your body is in space. But with age, those sensors get fuzzy. Imagine trying to play a piano when the keys are out of tune. No matter how skilled you are, the music won't sound right. That's what happens when we skip balance training. A 2023 review in Frontiers in Public Health looked at over 3,700 older adults. The result? Balance-specific exercises reduced injurious falls by 19% and improved stability by more than 15 points on the Berg Balance Scale. That's not just numbers. That's fewer broken hips, fewer hospital stays, and more freedom. Joan, age 72, told me she was tired of tripping over rugs. Her muscles were fine, but her body wasn't catching itself quickly enough. We started simple, 45 minutes, twice a week. First, standing near a counter for support, then tandem walking down her hallway, heel to toe, slowly, like walking on a balance beam. After 6 weeks, Joan said, "I finally trust my feet again." Here's the key for you. Start small. Practice standing on one leg while holding a chair. Progress to heel-to-toe walking or gentle yoga poses. If possible, add dual-task challenges, like counting backward while balancing, to train both brain and body. Ignore this step, and the sensors in your muscles keep detuning. Train them, and you're tuning your piano back into harmony. But that's only half the story. The next mistake isn't about training at all. It's about something in your medicine cabinet quietly tipping your balance off track. 4. Mistake number 4, not reviewing medications. Sometimes balance problems don't come from your muscles at all. They come from your medicine cabinet. Certain prescriptions like benzodiazepines, sleep aids, and even some blood pressure pills can tip your balance without warning. They slow your reflexes, blur your senses, and quietly raise fall risk. A 2022 Age and Aging meta-analysis showed that older adults taking benzodiazepines had a 42% higher risk of falling, and the danger increased with higher doses. That's a huge number, nearly half again the risk, hidden inside a tiny pill. Helen, 74, came to me after 2 sudden tumbles in her kitchen. She thought her legs were failing, but when we reviewed her chart, the real culprit was medication overlap. Her doctor carefully deprescribed what wasn't essential and switched the timing of her blood pressure pill to nighttime. Within weeks, Helen's dizzy spells eased and her confidence returned. Think of your prescriptions like a box of tangled headphone cords. If you don't sort them out, one knot pulls on another until the whole system malfunctions. But when carefully untangled, each cord works smoothly again. Here's what I recommend. Ask your doctor or pharmacist for a medication review every 6 months, or anytime a new drug is added. Discuss timing. Taking blood pressure medicine at night can reduce morning dizziness. Never stop a medication on your own. But do ask if safer alternatives exist. This step isn't optional, it's foundational. Because the most dangerous falls aren't from weak legs, they're from dizzy minds. And yet, even with the perfect prescription plan, one more silent mistake at home can undo all your progress. Let's go there next. 5. Mistake number 5. Poor lighting and home hazards. Even if your body is strong, your environment can quietly trip you up. Dim hallways, loose rugs, cluttered floors, these small hazards add up to big risks. One large study in injury prevention, Kiel et al., 2015, showed that simply improving home lighting cut falls by 28% in older adults. That's nearly 1 in 3 dangerous falls prevented with something as simple as a brighter bulb. I'll never forget Tom's wife, age 70. She almost slipped carrying laundry at night. Their hallway light barely reached the floor. After installing motion sensor lights and securing rugs, she said, "I didn't realize how much I'd been walking in fear." For her, that small fix felt like unlocking freedom inside her own home. Think of your house like a garden path. When it's smooth, well-lit, and clear, every step feels effortless. But if it's dark, uneven, and cluttered, even the strongest walker feels unsteady. Here's what you can do right away. Add nightlights in hallways, bathrooms, and near stairs. Secure or remove loose rugs. Double-sided tape works wonders. Check stair railings. Make sure they're sturdy and easy to grip. Keep commonly used items at waist height. Less reaching, fewer chances to overbalance. These aren't cosmetic fixes. They're protective layers for your independence. Too often, seniors accept fear inside their own homes, when a few small changes can restore confidence. And this is where your body starts saying yes again. Because once your home is safer, your balance efforts finally have a chance to work. But there's one more mistake most women never connect to balance at all. Something happening deep inside the body as hormones shift after 60. And it changes everything. 6. Mistake number 6. Overlooking hormonal shifts. Here's a balance mistake almost no one talks about: your hormones. After menopause, estrogen levels fall sharply. And estrogen isn't just about hot flashes or bone density. It plays a critical role in the inner ear. Studies in Aging and Disease 2024 show that declining estrogen accelerates the loss of vestibular hair cells, the sensors that keep you upright. Think of estrogen like the oil in an engine. Without it, friction builds, the gears grind, and the whole system struggles. That's what happens inside your balance network when estrogen runs low. One of my patients once told me, "I thought my dizziness was just age, until I realized it started the same time as my night sweats." She had never connected the two. Her physician explained how estrogen deficiency disrupts the delicate ionic balance in the vestibular system. With tailored hormone management, plus strength training and proper sleep, her episodes eased and her stability improved. Now, I'm not saying everyone should take hormone therapy. That's a conversation only to have with your healthcare provider. But here are safe, practical steps. Discuss balance issues with your doctor, especially if paired with menopausal symptoms. Support your body naturally with resistance exercise. This boosts muscle sensitivity to balance signals. Prioritize restorative sleep, since hormones repair during deep rest. Consider calcium and magnesium from diet to support nerve and muscle function. Your body isn't betraying you. It's adapting to a new chapter. And when you give it the right support, even hormonal shifts don't have to push you off balance. But what most people don't realize is that balance loss itself is often misunderstood. Let's clear up one of the biggest myths right now. We've uncovered 6 mistakes that quietly chip away at balance, from inner ear changes to skipped vitamin D to overlooked hormones. But here's the hopeful truth. Your balance isn't vanishing. It's waiting for the right support. Every small change you make, whether it's brighter hallways, steadying drills, or smarter nutrition, adds up to a stronger tomorrow. Take a moment and picture this. Stepping out of bed in the morning, walking across the room without reaching for furniture, carrying groceries without fear of stumbling. That confidence isn't gone. It's still inside you, waiting to be rebuilt. And here's the whisper I want you to remember. Take one step today. It can steady many tomorrows. Because balance isn't just about preventing falls. It's about protecting the freedom to live on your own terms, to garden in the spring, to play with grandkids, to walk hand in hand with someone you love. That's the legacy of independence worth guarding. Now, I'd love to hear from you. Which of these 6 mistakes feels most familiar in your own life? Type it in the comments. I read every single one. And if this video helped, please hit the like button. It tells me these conversations matter. For more science-backed, senior-focused guidance, subscribe to Healthy Aging Hub. Together, we'll keep building the strength, clarity, and confidence you deserve in this next chapter of life. Stay steady, my friends. Your best balance may still be ahead.